So we do have a very good and solid example or case studies of COVID-19 that because COVID-19 is such a disease which is started by China and whole world is suffering. That was a fake news. And then that you must not have a COVID vaccine because America or XYZ powerful nations are trying to control you while injecting a single injection there. So it was again a fake news. And I have been reporting on COVID-19 for the whole year, and still I do work on these health facilities of Pakistan as well. And then when one day when I was reporting that COVID-19 issues, and some of the audience, they were saying, well, we are not interested in having that COVID vaccine because we will die. It is just like you will die after a few years. So international world is trying to mitigate the population of Pakistan. So that's the one reason they are always opting to have COVID vaccine, especially it was started by China and it will end up by XYZ powerful nation. These were the wordings of those public, but who would make them understand? I tried my level best on camera as well as off camera. If I do talk about the changing health narratives from 1947 to 2025, we do have, that early years, then slow reforms, then digital era. So from 47 to 70s, that was the print and radio controlled by state and medical elite. We know that even right now, the media is controlled by powerful elites. They have their own, beneficiaries are there. They have their own choices. It's owned by all powerful elites, and even the media is controlled by the state through different kind of rules and regulations. If you talk about the broadcast media, like print, like radio and television, it is basically controlled by your PEMRA, which stands for Pakistan Electronic Media Regulatory Authority. It is owned by the government. It's not like, by any expert who is getting into all the details. That's the government. If any news going against the government, they will always try to play it down. Play it down means you are not allowed to honor their content because it's against such policies. And sometimes what government do is government always target the top news channels that they need to focus on the experts which government should suggest, and they do have such expertise as well. And then slow reforms were there where the rise of private sector was increased from 80s to 2000s. And then 2010 to 25, we do have digital era where we are like one of the panelists said, well, you are writing for the Dawn News, you are writing for Express Tribune, and then I respect you because you are doing very good job, but still it's not enough for us to write. It's not enough for us to have a one vlog or any podcast like that. But I must suggest every one of you, whoever Pakistani is holding this Pakistani flag or this green flag, they must raise their voices for the health. And then you can use the social media, you can use these digital media, you can use these blogs. Then the all in all, that makes one journalism type, that is citizen journalism. And now public now actively ask questions on medical practices, just like one of the Dr. Afan and the family. They are giving very good information in some cases, but nowadays Dr. Afan, he's a doctor, but he is giving political analyst as well. This is something drawback in the history of Pakistan, that we are expert of one field, but we are stepping into 10 other fields as well and try to act like we are the experts of those as well. But that is one of the drawback, I must say. And then voice of resistance is very important. All those who are whistleblowers in Pakistan, like doctors, nurses, or experts of those health facilities in Pakistan, or any kind of journalist who is having, investigative journalism, they must look into all kind of resistance. And then patients advocacy groups are very important. All those group of doctors, group of nurses, group of paramedical staff, all those are requested to be part of that raising voice. And then other than this, we do have journalists and then systems which are working for that cause. That's very important. If I do talk about the roles of digital media, we have pros and cons which are very important, especially from 2010 till now. The pros are like it helps us to have a lot of stories of different passions. Like they always opt for such stories which are based on a reality. They promote health facilities, like we do have media literacy, we do have educational literacy now. I must suggest you all to get into this health literacy other than this digital literacy. You must know what are the basic health facilities which are available in Pakistan, and which laws of your constitution are dealing with these health facilities. And then we always get into the facts and figures. Until and unless you are not getting into facts and figures, you must not have a talk on any word which or any health facility in Pakistan. One of my panelists shared a lot of statistical data, and based on that data, I endorse you, and I have deleted those slides from my PowerPoint presentation as well, because you have already done with that. There were 7 slides which I have deleted, but I do endorse all the data which you shared of 1920 or 2019 or 2020 or 2024, 25 onward. And then if you do talk about the cons, we have always witnessed that there are always misinformation cases, because of COVID, you will die very soon. And recently one of the case was appeared on screen of one of the prominent media house, that they said, well, because of the vaccine, you will die very soon. It is just like, have a vaccine in 2020, you will die in 2030. It's obvious. Whoever have received a vaccine, they will die after 20 years. I mean, this was the news that was shared by some of the media house. I do respect that one, but digital media of the media houses, they must get into the facts, figures, details, and get into all the organizations who are dealing with that facts, just like the primary health, like the secondary health, like the tertiary health, all the health ministries, provincial as well as the federal ministries. And then we have defamation without verification. If you are having any fake news on screen of any television, remember, you will always receive a defamation case where the license of your organization might get suspended. Or if you are having any program, just like 7 p.m. program, 8 p.m. program, 10 p.m. live program, or 11 p.m. program, if you are having that fake news aired, definitely your program will always be off air because of that fake news. So I must let you all know that it's very important. You must keep a vivid eye on all the facts, figures, and statistical data from a credible source, which is very important. And then, other than these health groups and these journalists, the role of educational institutions is very important, where every institution must get into the details. But nowadays, so many institutions in Pakistan are starting, health communication, that how health must be in any country. If we do compare UK, US, or Pakistan, I do have later on slides which we will get into. And then they must integrate the health journalism into media studies, which I am just trying my level best to have such kind of discussions. And sooner or later, we will have that health communication courses we will offer, and some of the universities are also offering. So we need to train students in getting into or digging the facts and figures, and opt for ethical reporting. It's health, it's education, it's economy, it's political beat, or it's whatever the beat you have opted for. I must expect every journalist to get into the facts and figures and report the ethical way. And then I must encourage every empathy in health storytelling. It is one of the con of the Pakistani audience, that when I was having a program on COVID-19, the lowest rating I was received was this health and education. 2 sectors I focused on. What should be the quality of education in Pakistan regarding that education? And then there was one curriculum idea. It was, coined by a federal minister and then provincial minister for Punjab in previous government. When I was having program on education, it was the lowest rating ever I received. The second one was the COVID precautionary measurements. one of the program was on top, and rest of the 35 programs of 1 hour, 35 hours of mine, they, I think, based on that television program, because of my ratings or viewership that I received, I have lost so many of my episodes while having program on health. Despite of that, I continued my role as a journalist to for my community to work on my health and as well as education, and still I do suggest such kind of topics for my those anchors and producers who are having programs. And then in case of, again, educational institutions, they must have a collaboration with healthcare professionals that in learning how to have a reporting or teaching a journalism, they must ask for healthcare expert to be in class and let them know that how to report all the health beat news. And then storytelling for reform is very important. You can opt anyone who wants to have a program, you can have a podcast, and you can ask the patient's journey and reforms narratives from any health expert. You can have, these documentaries where you can explore systematic exploitation. And then AI is helping us out in having all the podcasts, documentaries, and short films. You can have take an idea from there. You can take the context that how you can do it, and then you can have the outlay of that one. You can get the outline of that. Even while on a single prompt, you can receive the whole detail of every talk, what you want to do as a reformer within your society on health. You can take help of AI, and you can be a good storyteller from podcasts to documentaries and documentaries to short films. If I do talk about the lesson of 78 years within Pakistan, the progress is possible, but vigilance is very important, which is the key. And we have witnessed that we have been lacking into vigilance of the data within Pakistan, which is very important. What kind of facilities we are providing to the health, what kind of facilities we are providing to education, and then public awareness is very important. One thing I must endorse by the media houses during COVID-19, every media house was utilizing their anchor persons, just like doctors, how to wash hands. There was one public awareness, not to have a handshake, not to hug someone. Then, how to meet XYZ, like you can use your elbows, and then all the facilities were having an awareness session on television program, and then usage of soaps, and then Dettol soap, and all those type of soaps and sanitizers, and then using masks, and all those facilities were being well done by every media house. And then digital platforms are nowadays very powerful tools, but we make it sure everyone who is on digital platform, you must use your digital platform very precisely, getting into the facts and figures. If you do not have any credible source, be quiet. If you are having any fake news on media, and you do not have any credible source, you might be behind, you might go behind bars because of the PECA rules. So PECA is very important. Pakistan Electronic Crime Act. It was started in 2016, forwarded by a previous government, and now this government has amended, and the rules are very strict. You cannot have a bash of XYZ minister and their performance on media, and you will be arrested. One of the media person who was using their social media, and they utilized one of the fake video generated by AI of one of the chief minister. I don't know, that guy was behind bars because of that act, using or utilizing or the AI fake video updated on social media. He was arrested. So make sure, we started with nothing. We are ending the Pakistan after 78 years, means from 47 till 78 till 2025. We are facing severe issues.